Okay, well, it is officially noon, and although we have some folks still joining us, we will go ahead and kick things off. So thank you, all of you out there in virtual land. I know that this has been very normal for us, but it's also a really convenient way for us to put something together when we're getting a lot of questions from our clients and contacts that we have out there in the industry about some of the changes that are coming up with medical debt and credit reporting. And so as we've received a lot of those questions from our community, we really just wanted to put together a forum, a platform for us to get together and have a discussion and share some insights. So we know enough to be dangerous, right? But we are not legal experts or compliance. So just make sure, we like to give that disclaimer, like make sure you check with your own team to be sure and certain of the information that we're providing. But we do have a great team from Keybridge on this morning, including Brad Stevens, who is our manager of bad debt in our bad debt division and handles that compliance, along with Angie Theus, who is our director of client relations. So really knowledgeable about the changes that are coming up and how it will impact you as a healthcare provider, how it will impact companies like Keybridge, who maybe you're partnering with for your bad debt services. And then as well as Brian Garver is going to be sharing. Many of you may have already met Brian in the past. I know he does a lot of speaking and engagements. And then Brad Wilkie, myself, Kayla Howell, Susan McDonald, and or Robin King, who are your business development leaders. And you probably got an invite from one of us. So again, like I was just saying, if you have questions after this session, you want to make sure you receive a copy of the slides that we're sharing, or today's session will be recorded so you could go back and revisit that. Please reach out to ourselves, or Kylene will have her email and contact info on the screen at the end. All right, so just a quick heads up, like what are we here today to cover? So again, just kind of sharing our interpretation of the current communication around the credit reporting changes, how that's going to impact medical debt, what's coming in the future. So some additional changes that are projected to happen in March of 2023, right? And then what does that mean for you as the healthcare provider? How we can make sure that this doesn't have any negative impact. I think there's a lot of ways that we can make this so that we can continue to run very successful businesses. And then lots of time for questions at the end. So there are some that we've already received ahead of time, that we are getting as kind of those FAQs. But also any other questions that you may have that come up throughout the presentation, please feel free to drop those in the chat box, and we can either address them as we go, or we'll make sure we give time for that at the end. As well as, at the end, you are more than welcome to take yourself off of mute and ask that question live if you would like. So I think that is all for me. Thank you again for joining, and I'm going to pass things over to the rest of our team of experts.
Good afternoon, everybody. Thank you so much for joining us. Let's talk currently about what happens when an account is placed with a collection agency who reports to consumer to a national credit reporting agency. And we're talking about Equifax, TransUnion, and Experian. Every agency's policies and procedures may differ. So we're going to use Keybridge as an example on what our policies currently are. So at Keybridge, we always give the consumer approximately 35 days from the date the account is placed with our agency before it really becomes eligible to be reported. That 35-day window typically gives the consumer the ability to pay the account before it goes on the credit. It also gives them the opportunity to dispute something that they may not feel is correct. We also put a $25 minimum on the account before it gets reported. So that's also something they differ from other agencies. Now, the Fcra, which is the Fair Credit Reporting Act, they also have guidelines and stipulations that we have to follow. For instance, the account must be at least 180 days from the aged or the date of delinquency before any account medical can be reported to any national credit reporting agency. We also need to provide Equifax TransUnion Experian with a full file, which must include the consumer's full name, social security number, the date of birth. So that information needs to be in our file before they will accept any reporting. In late of 2020, the CFPB published what's known as Regulation F, or the debt collection rule. They gave collection agencies 1 year to modify their business practices to comply with what the debt collection rule. One of those rules had to do with credit reporting. What that means is they put specific guidelines on agencies who report to the credit reporting agencies. The CFPB noticed that many agencies across the country were doing what's called debt parking. What debt parking is they were reporting accounts to a credit report without sending any notice to the consumer whatsoever. And that was perfectly okay. The consumer would pull their report, they would see something on the report says, I didn't know I owed this bill. They would call the collection agency, say there's something in my credit report. They would pay it. The FDCPA states that if a consumer does not dispute and they pay it upon first contact, the agency did not have to send a first notice. So this was a way for many agencies to save costs, but also increase their recovery. But the CFPB demanded a more straightforward approach to requiring agencies to notify every consumer that they had an account in collections or were at risk to be reported before an agency could report. So as of November 30th, 2021, all agencies, if they were to report to any credit reporting agency, need to notify the consumer well in advance before that agency could report. So currently at KeyBridge, we send out the notice to every consumer. We give it approximately 14 business days, and that's the Reg F suggested timeline. They're saying that it has to be a reasonable amount of time the consumer to receive the notice that they have a bill in collections before you can report. So if we get notified within that 14-day period that there was mail return or the consumer, the notice was undeliverable, we have to remove that file from our records and we can't report it to the credit bureau. Regulation F also stipulates that if you choose not to send the notice and you want to tell the consumer verbally, that's also permitted. So if the consumer would call and they knew they had an account with our office and we had mail return, but we physically notified them verbally of the account, at that point, the account becomes eligible to be reported. So those are the two ways that we can now report, either through letter or verbally notifying the consumer. So that's currently in place. And then early this year, while we're all here, there were some additional changes that are coming forward in the next couple months and the next year.
I'm on mute. Imagine that. So what's coming? There's a few changes that are on the way. Don't worry. We've got you covered. We've got this. That little guy, he's so cute. So this is our interpretation from the offices of KeyBridge. Again, as Kayla had stated, we're definitely not attorneys, but we do our very best to keep all of our providers and all facilities compliant. You're what's important to us, and our clients make our business work. So the things that are coming very soon, actually, July 1st of 2022, just around the corner. How did that happen already? The first thing that's coming is the pay to delete. What happens is now it's just going to be common practice for any consumer who has a medical debt that's been reported. If they pay that in full, it will be deleted from their credit report. Now, not that that didn't ever happen before, because it did in certain circumstances. But previously, it was kind of a gray area. Keybridge and agencies are data furnishers, and we rely strongly on the validity of the data that we supply, and our reputations and just relationships with those three major credit bureaus. So it kind of created a gray area. If things were deleted, if you had a lot, it could raise some red flags. Is the data that you're providing valid? Is there an issue with your data? Things like that. So it was a little bit of a gray area. But now, coming in July, we're going to see that's just going to be common practice, which actually could really work in our benefit. So consumers can now pay their account in full, and it'll be struck from their credit record. And it's okay. It's okay to tell any of your patients or consumers that that is the case. The second thing that we're going to see is wait to report. So Brad Stevens had mentioned just a little bit earlier that we waited until accounts were 180 days from the date of delinquency to report to the credit. It had to check that box before it would go to the credit bureau. Now, what's going to happen in the background is it needs to be 365 days from the date of delinquency. So it's going to be an even longer time before the consumer will see that on their credit report. So just a few things are changing. They're minor changes, but what we're going to see is it's going to make it just a little bit tougher to collect on that front. But we do have the pay to delete, so that is somewhat of a positive. So coming up even further down the road, so that was, of course, the very near future. This is a little further down the road, projected for 2023. They're saying Q1, so nothing's set in stone. We're kind of looking at end of March, probably, we're anticipating. But agencies will no longer be permitted to report any balance for medical debt that does not meet the minimum balance criteria of $500. So that's going to affect a lot. That's going to affect a big portion of the bad debt that we see. And just a little side note, that's per trade line. So when we report, it's per date of service or per account. So a lot of those smaller balance items will not make it onto the credit report, unfortunately. So that takes away one of our tools as an agency. The next slide. So how does that affect you, a provider? If you're from an agency and you happen to be on this call, you're pretty busy right now getting ready for this. But if you're a provider, not a ton that you need to do. We were just so glad that we could meet with all of you today to just take a moment and give you, a brief information-filled segment to help educate you on what's coming, just so you're aware. The first thing, the pay to delete, kind of like I said before, it's now okay. There's no more gray areas for pay to delete. So that's kind of going to be a common thing. And it's very possible that a lot of consumers will be well aware of this step. The wait to report, as a provider, you don't really need to do anything. You keep doing what you're doing. As far as your collection process, it can still remain pretty similar to what it is. We have a few suggestions for you. And later on here, I know Brian Garver will get to. But you can still place your accounts with an agency after 120 days. That's best practice, of course. Your agency should really take care of the rest. Agencies right now are working hard in the background to make sure that everyone, all of our providers remain compliant. So that third change that's coming up with, the dollars and the minimum balance, I'm going to turn it over to Brian Garver so he can talk a little bit more about that and the things that you can do to help maximize your situation.
Yeah, thank you, Angie. Hey, everybody, it's Brian. Welcome. I'm glad you're here, and hopefully you're staying inside. You've got the fan in your face, a little AC cranked up. I just heard that if any of you are calling in from the Midwest or around Ohio, we're supposed to set some new records today. As a matter of fact, for today, they're thinking this is going to be the hottest day on record since 1988 of this day. What were you doing in 1988 on this day? I was preparing for my freshman year of college, working for the Allen County Engineers Office. I was on one of their road crews. And that means we were paving roads. And I remember that summer because I worked my tail off, and it was so hot, summer of 1988. And it was a drought. There was no rain. It was baking. So yeah, I was actually on this day in 1988 out there with the blacktop melting. I weighed probably about 25 pounds less back then too. So maybe it didn't bug me as much. So anyways, hey, couple quick things. Like Angie was saying, these changes will make it harder. They will make it harder to leverage collection on bad debt. Okay. So this could impact some things. I mean, it's something we need to be prepared for so that you can minimize any financial impact of dollars coming in. Okay. Now, couple quick things, and I'm going to get into a little detail on what you can do. First of all, it is crucial now more than ever to maximize your recovery during that accounts receivable management or early out program, right? The first 120 days that self-pay balance exists. Collect it before it gets to bad debt, right? We've got to be rock solid there. We've also got to be rock solid in patient access. I see a lot of healthcare organizations really trying to step up their game of late in collecting those co-pays and so on and so forth during patient access. That's going to be crucial, getting those dollars sooner so that they don't flip to bad debt. We'll give you some ways to look into that. Also, it's extremely important to collect accurate and up-to-date information during that registration patient access period. Reason why? We collect a lot of data, right? We have both an early out division and a bad debt division. And here's what I can tell you. We've had millions of accounts come through our bad debt division over the years. Millions. Of all those accounts, 76% of them have bad information. Think about that. 76% of all the accounts that get placed to bad debt, of these millions of accounts, have either an incorrect phone number, missing phone number, an incorrect address, missing address, so on and so forth. And that's for a lot of reasons. It's not always on the provider. It's just patient, changing around, moving around, bumping around, changing phones, or maybe even just giving some bad information at times. But we know that because some of this leverage is being taken away through the credit reporting to collect bad debt, your agency, whether it's us or anybody else, they need accurate info. It's going to help them recover that balance more effectively at a higher rate and collect it sooner. So I know all of you, and I've talked to a lot of you before, you emphasize that with your patient access teams. I've been in part of those training sessions where I've seen you emphasize that with patient access. Continue to do that. It's a critical component of being effective if and when that account does get to bad debt. All right. So how can you minimize this impact, right? How can you minimize this potential financial impact of making it more difficult to collect in bad debt? Well, number one, like we said, maximize your point of service training and maximize how you're monitoring collections at point of service. I've seen multiple hospitals that I've worked personally that implemented some ongoing training, and we were happy to help them with that during patient access. how to have those difficult conversations about money. And then they also started measuring how much was being collected during patient access per day, per week, per month. And that information was reported back to those patient access teams and showing them the progress they're making. Sometimes just sharing that data in a very regular, real way that's with an emphasis put on it helps a lot too, because people know what the goal is, set a goal, and then let them see what's happening. Are they making progress to that goal with point of service collections? And that's going to come through a lot of training. And that's a difficult department. Any of you out there that have responsibility for point of service, I feel you. We know what you're up against. You know, that's often an entry point for employees and a healthcare provider. And then you get them trained, you get them going, and next thing you know, they're moving on to other departments within your organization, and you start right back over again with someone new. So I get that it's a challenge. It's going to be one that we're going to have to really crank up our emphasis on. Number two, utilize legal process for bad debt whenever possible. I know a lot of hospitals don't want to use legal because there's some potential risk of PR, right? Maybe a dent in PR. Here's the key. We want that leverage, right? Especially now that the credit reporting is being taken away. You want to use that leverage of legal if you can. The key is this: make sure that the agency you're working with has a really robust pre-legal process. That's how you avoid getting any dings from a PR perspective. You don't want to pursue legal with patients that just can't pay. I mean, it's just not going to happen, or that just went through a very recent traumatic situation, whether it's a death or a divorce or bankruptcy. You know, those are accounts that through the pre-legal process have to be found and put aside and not recommended for legal by your agency. So that's your key. Don't be afraid to use legal. Just make sure that you're engaging with your agency and have them show you how stout or robust their pre-legal process is. If it's not a stout program, I would encourage you to take a look around that, because there's some organizations and agencies that do a really nice job of that, including Keybridge. So continue to send accounts to your bad debt vendor in a timely manner. That's one thing you can do. You know, we work with a lot of healthcare providers all throughout the Midwest, and we see accounts coming to first placement bad debt with all types of aging. You know, some providers are getting them to the agency at 150, 180 days. That's good, right? And that's from date of service. Other folks are getting them at 210, 220 days. Still not bad, but there are providers out there that are just holding on to those accounts for 280 days, 300 days, or longer before they're getting them to their bad debt agency. That's going to make it tough. It's going to make it tough on that agency to have success. The accounts now become so aged, you know, the patient has distanced themselves emotionally and from their remembering their personalization of that actual event where they were in the hospital. They've distanced themselves from it because it's so old, and now they don't have credit reporting as leverage. So it's going to make it even harder. So get those accounts to your bad debt agency in a very timely manner as soon as possible. Lastly, ensure that your accounts receivable management or your early out process is booming, that it's robust, that it's highly effective. You know, benchmark it, do some comparisons, do some research. Again, we've got to be effective collecting those patient balances before they get to bad debt. So that's the other thing. Now let's jump into how you can utilize some of your resources to accomplish these things. First of all, experience. Check with your agency. Do they have experience of being successful in collecting bad debt accounts without using credit reporting now? Because some providers, you know, already have checked that off. They've scratched it off their list. They've said, hey, whether it's to Keybridge or any other agency, they're saying, hey, yes, we want to place these accounts with you for bad debt, but we do not want you to credit report. We have clients like that now. How is your agency doing? Do they have experience collecting in that situation? You'll want to validate that with whoever it is you're working with and make sure that they do, and find out how. And by how, I mean using a different approach. You know, find out from your agency, what is their approach to collecting bad debt accounts when they have no leverage, right? There's no leverage of credit reporting, no leverage potentially of legal then too, if that's the way you're headed. So how are they effective? What type of approach do they use to maximize collections when there are no tools with the credit reporting? You'll want to check that out. Make sure that they've got a sound approach that works and they can show you evidence of how effective it is without credit reporting. Another one, are you using digital engagement with patients during those first 120 days, right? We want to maximize collections before it gets to bad debt. One way that's proven to do that, we've got the data that shows that it does that, is using digital, because digital happens quickly during that early out process, right? As opposed to sending, 3 statements and a final notice 30 days apart through snail mail, and then it goes on the patient's kitchen counter, maybe ends up in their trash can. Instead of that, they're getting, click to view, click to pay options on their cell phone or electronic device to take care of their bill. There's a huge population of patients now that's how they want to engage about their bill. That's their preferred method. And they will pay more quickly because of it, and they'll pay in full more often because of it. So if you're not using digital now during those first 120 days, please explore that, look into it soon, because it will give you an opportunity to collect more without relying, on that collection to happen during the bad debt phase. How about your current situation? When's the last time you've done a thorough audit of your current situation? That could be auditing your point of service collections. How's that going? What are you collecting during point of service versus what's the opportunity to collect during point of service? That's an important aspect. Just measuring what are we collecting only, that's good. And I applaud you if you're doing that on a very daily, weekly basis. But what you really want to do is measure what you're collecting versus what was the opportunity to collect. Okay, so audit that, see where you are, and then again, emphasize that training and working with an organization to help you do some training and maximizing those collections. Also, auditing and benchmarking your current accounts receivable management process, that 120-day workflow, or your early out with a vendor. When's the last time you've audited that too, to make sure that recovery is high, that the program is robust, that there's a digital option if you'd like to pursue that. Make sure that the patient experience is being measured and that it's high. Because if you're auditing that early out process and the patient experience is high, there's a good likelihood that recovery is being maximized during that process as well. Same with bad debt. Now's a good time to audit that. How is performance going? When's the last time you've done a deep dive on performance versus what else is going on in the industry? So to minimize the impact of the credit reporting, use your resources. These are some great tips on things that you can do. And lastly, get some, reach out to your resources and to your vendor partners for assistance with training, whether it's customer service training for people on the phones, whether it's your patient access training for point of service collections, or whether it's just even building a high performing team within your business department or building a culture for success within your business department. Those are programs that are out there, and there's great training available out there that is available to you. So make sure that you're checking on that as well. Now, we're on the home stretch here. We've got some frequently asked questions from patients that we wanted to share with you, right? What are patients asking us in bad debt? So we thought we'd share a few of those frequently asked questions and share some answers to them with you. There's just a few here. First of all, Brad, how do I dispute something that's on my credit report?
It's a great question, Brian. So every consumer has the right to have access to one free credit report a year. You can do that through a site called annualcreditreport.com. Now, I think during COVID, I don't know if that's still in place or not, they allowed consumers to access the report more than once a year. But you can pull your report, anything on there that you don't agree with, there's a section on your credit report. You can simply just flag it as disputed. The agency, the credit reporting agency like TransUnion, they have to reasonably investigate the dispute. So what they'll do is they'll contact the data furnisher. So if it was KeyBridge, they contact us through a system called eOscar. We investigate the dispute, either confirm that the debt is valid, or if it's inaccurate reporting, then we are required to remove the trade line. So that's usually what we encourage consumers to do. If you see something on your report that doesn't seem right, or you don't believe it's your debt or your credit report, go ahead and dispute that with the agency, wait for a response, and they'll return the response via email letting them know the investigation is complete, and they'll give you an update on the areas that you've disputed.
Thanks, Brad.
Yep.
Here's another one. How can I get this off of my credit report now? So there's something on my credit report. What do I need to do to get that removed from my credit report?
Another great question. Before, it was a little trickier depending on what agency that you were working with. Some agencies, they did a program called Pay to Delete. If someone wanted to remove it from the report and they asked the agency, sometimes the agency would agree just to remove it from their trade line if they paid the account in full. That's all changing July 1st. Any consumer that pays their account, it just becomes deleted. Our agency is required to furnish this information in our monthly file starting in July. So anything that does get paid gets removed from the credit report, usually within 30 to 45 business days.
Thanks, Brad. If I make payments on my medical bills that are with a collection agency, how is that reflected, or is it even reflected on my credit report?
Another great question. So collection agencies who furnish data to credit reporting agencies are required by law to send complete, accurate, and updated information to pertaining to debt. KeyBridge, being a collection agency, is not a credit grantor. That doesn't. So what that means is that we're not really furnishing information that shows that they're in good standing or that they're in bad standing or they were on time. All we're required to do is update the current status of the debt and if it's paid or the current balance. Credit grantors like credit cards, banking institutions, they are required to report if the payment was made on time or if it was late. But third-party agencies like KeyBridge, we're only required to update the account if it's disputed, paid, bankruptcies. And then if someone disputes something on the report and then they notify us that the dispute is no longer disputed, then we are also required to update that file that the debt is no longer disputed.
Thank you.
Yep.
So we'll open this up to some questions and we'll provide some answers. We had a couple submitted before we started, so I'll start with that one. We had a provider ask that, will our accounts that are in early out continue to be worked until they hit the 365-day mark now? Or will these be returned to the hospital? Either way, it looks like our AR is going to take a hit, they said. You want to touch on that?
I can, yeah. Oh, I'm sorry, Brad.
No, go ahead, Angie. No.
Yeah, you can definitely still turn those accounts over to collections. The only thing that's changing is that your agency cannot report it to the credit report. We can still do bad debt collections, just no credit reporting until day 365.
Excellent. Another question that came up was, what percentage of our total bad debt will be affected by the new ruling for the 2023 change, where they say that no reporting is going to happen for accounts under $500? How much of that, accounts under $500, that's probably a big percentage of our overall placements, they said.
CFPB, by the way, this is Brad Wilkie, and I apologize for no picture. I'm having some sunspots. Brian was talking about the heat. I think it's affecting our connectivity. But the CFPB reported that this is going to affect 80% of the accounts that are reported to the credit bureaus currently will be affected by that $500 balance limit. So it's a very large number. It's going to be a real challenge for us going forward. But that makes it even more important, as Brian said, to make sure you have the right partner that can even deal without reporting to agencies.
I want to point out too, Brian Garver had mentioned utilizing your legal program if you have one. Whereas reporting to the credit agencies, there is that criteria of a minimum balance of $500 that does go by trade line. As far as the legal program goes, there's minimum balance requirements there as well, typically from an agency. Some providers set their own, but that is really an aggregate balance. So if that consumer has, 3 accounts at $250, that would still qualify, depending on what your preferred minimum balances are for a legal suit.
Thanks, Brad. Thanks, Ange. Any other questions? Does anybody want to pull that off the chat? Anything coming up?
I don't see any other questions, Brian. I did have one that was sent earlier. It was a question about the hospital had been pulling back their bad debt at day 365 so they could write off their bad debt or Medicare bad debt on their cost report. The question was, should there be a new strategy? And one of the things that we might suggest, and Brad Stevens was talking about this, is perhaps extend that to a year and a half so you can have that 6-month period where it is getting reported to the credit bureaus. It's just a strategy that you might have as a hospital. That's what the question was.
Great point. Okay, any other questions?
This is Melissa Athea with Memorial. First, it might sound naive, but what do you define as date of delinquency? Is it date of service, date of placement, or the date they become delinquent, quit making payments with the agency?
Oh, that's a great question. It's you got to follow the policies and procedures that your agency has written. So some agencies define that as the date that it becomes assigned to collections. Keybridge, we define that as the date of service. So the date the services were rendered and the balance did not get paid is the date that we consider the date of delinquency.
Okay. Previously reported debt on patients' credit reports currently.
Mm-hmm.
And by the way, we quit credit reporting several years ago now. I won't lie to you because it was of no benefit and it was just costly to our agency, but we do pursue legal action, which when judgment is granted to Memorial Health System, the courts then puts it on the patient's credit reports. So two-part question there. What happens to debt under $500 currently on credit reports? And when the judgment is granted and it goes on the patient's credit report, does this ruling apply to that based on balance?
Two great questions. So anything under $500, according to the documents I received, that agencies received, is that they're going to do a mass cleanup of all consumers report. So after July 1st, consumers are going to see a huge uptick in what their scores reflect because all of those debts are going to be immediately removed. Nothing under 500 is going to be will remain on their report. Second question, judgments. This has no bearing on the judgment regarding legal action as of yet. So any judgments that gets placed by public record that gets picked up by Equifax, TransUnion, Experian, those will remain in place. Now that could change in another year, but right now it's understanding that judgments will remain.
Excellent questions.
That's all the questions that I had.
Okay, thank you. With that, again, we just want to thank you from everyone here at Keybridge. We value our relationship and partnership with all of you. If you want more information or if you would like a copy of today's presentation, which has been recorded, you can reach out to your Keybridge business relationship manager or the person that invited you today, or you can simply just email the address that's on here, kcote@keybridgemed.com. We'll make sure you get it that way too. Or if you'd like help with any of those tips on the resources piece of this, whether it's master classes and training for your patient access group or business office, or whether it's an audit of your current situation. If you'd like some assistance in any of those areas, we'd be happy to help. Feel free to reach out and we'll circle back with you very promptly.
Brian, before we close out, Amanda White had a late question.
Thank you.
So you're sure. So what if patient has combined accounts. The original account balance is less than 500, but after combined, it's more. So they revisited the hospital, and it's you know, I think we've already addressed that, but let's talk about that one more time, Brad. Is it or Angie? It's per occurrence, correct? If it's under 500.
Correct. So, but if a hospital or physician office chooses to combine dates of service into one statement, and that statement is over 500, then it becomes eligible. So if I was seen at the hospital 3 times in a month, and the hospital decided to combine 3 dates of service into one charge, and that charge was totaled 750, and you assign that account into collections, then yes, it becomes eligible. If you sent 3 separate accounts, each under the 500 mark, then it would not get reported.
Thank you, Brad.
Yes.
So Brad, to clarify that just a little bit, it would be if I had 3 dates of service, one in January, one in March, and one in June, and I had 3 separate placements to Keybridge, those would not report because
Correct.
each line item was less. But if the
Right.
provider sent that as one account for $700,
Mhm.
all of the charges combined, it would qualify to be reported.
Yes, correct. In the way that the CFPB required agencies to itemize out their first statements, it would reflect those 3 dates of service on that first notice. So it would show that the patient owed 750, and then that it would give you an itemization of where the agency came up with that 750 total. So there are ways around getting around that $500 limit by combining multiple dates of service into one statement.
So
bill.
that makes sense. So you're speaking of a Keybridge statement, not a
Correct.
provider
Sorry.
statement.
Yes, Angie. Correct. So
Gotcha.
the Keybridge statement, we would send out one notice. If it was over 500, it had multiple dates of service. We can certainly itemize that out and also report that account to credit after the
Great.
365 days.
Sounds like a strategy.
Yes.
Good
Brian,
to
I think that's it.
Okay. Thanks again, everybody. Thanks for joining us today. Please reach out and stay cool out there. We'll see you all soon. Thank you.
Thank you.
Thank
everybody.
you. Thank you.
Bye-bye.